Hey, everybody. Welcome to episode 116 of the Gen Z podcast. A lot of my episodes end up winding back or coming back to jujitsu, of course, because that's my love, and not always intentionally. But this next guest is actually the wife of one of my Chicago jujitsu teammates. We go way back. And I've always wanted to have an optometrist on. I love glasses. I love frames. I love them as an accessory. I obviously need them. I can still see without glasses, but it's great to be able to dress them up and just have fun with them. But I really wanted to talk about some eye health and preventative care and things we can do. So I have Dr. Veronica Kacherova. I hope I said that right. But Dr. Veronica, thanks so much for being on and taking the time.
Thank you so much for having me. I'm very excited for this. Thank you. I've heard so much about you. It's wonderful to finally talk to you.
I know it's so great to see you. And I feel like I've gotten to know you a little bit over some of the social media posts that you guys have been putting up. So it's been great to see you, your smiling face. I love the energy of the practice that you guys have. And congrats to you because you recently opened your own location, correct?
Yes, I did. So I've only been here since beginning of December. So this is just month 3. I've been
Oh my God.
practicing a long time. I've been practicing in the area around here too, but now this is finally my own baby. I'm very excited. It's been a long process. It's been kind of long overdue, but it's happening and we're finally open and the practice is beautiful and patients are coming in and my old patients are starting to follow me as well. So it's just been really a blessing to be able to do this.
That is awesome. I'm like, welcome to entrepreneurship.
Thank you.
And being, a woman in business, that's huge. And that's something to be celebrated because, you know, I've had my own business for about going on 16 years now. And it's hard. I feel like not a lot of things can prepare you for that. And even though you are a specialist in your, in being an optometrist and you've had the experience, right? That's your specialty, but you have all these other things now that you have to worry about, right? As being a business owner. So that adds a lot more to your plate. So kudos to you for, taking that step and opening your own practice. That's awesome.
Thank you so much. It's definitely been a lot of learning and a lot of sleepless nights. It's reminded me of back in the day when my first child was born and you just don't know what's going on and you don't know how to handle it. And it's just every day is something new. And I hear that this something new part is never going to end, but I think I am adjusting well. I'm trying. 3 months in,
That's
I'm doing much
awesome.
better. Yes.
That's that's amazing. And time is gonna fly. It's crazy. Like when I say like it's been 16 years and my business has evolved greatly over the years. But it's just like, oh my gosh, you hit these benchmarks and you're like, holy cow, where did that time go? And you could be like so stressed in certain moments. And then it's like, a year later, you're like, oh my God, I totally forgot about that. That's great. You got through it. So
Absolutely. Even
awesome.
today, I was just doing something, and as I was doing it, I was dreading doing it, and I had to do some billing, and I wasn't sure what I was doing. And then as soon as I started doing it, I was like, I don't know why I was so stressed about it. It's perfectly fine. Like once you start doing it, it just starts flowing, and everything's okay.
Exactly. Exactly. I love that mentality. That's awesome. So you just opened, so your business is Expert Family Eye Care, and you're in Lincolnshire, Illinois.
Yes. So Lincolnshire is a smaller suburb, but we're surrounded by many very large suburbs around there. So it's a wonderful kind of family-oriented community. There are a lot. I really honestly see patients of all ages, from babies to seniors and really older people. So it's wonderful. I think the location is great. We're at an intersection of 2 big streets. We're on Milwaukee Avenue and 45. We're visible from the street. It's very accessible. The parking lot is huge. So I think location wise, it's just wonderful. And I love this town. And we'll live right around the corner too. So
Awesome.
it's very convenient.
That's amazing.
Absolutely.
When you
Yes,
can live
that was
close to
important.
your business.
That was
That's
very important
awesome.
to us. Yes.
Totally. Well, I don't know if Sergey told you, your husband, that my sister is one of the managers at Lincolnshire Wildfire. So she's right around the corner.
Yes, it is. It is right around the corner. I love that wildfire location. That's wonderful.
Yeah.
We're
So
going to have
she's
to
been
stop by
there.
and say hello.
You have to go say hello. Say hello to
Yes,
Sonia.
will
She's
do.
been in with Let Us Entertain You and Wildfire for years. Her husband manages Wildfire downtown in Chicago. So they're both in the restaurant industry and have been for a long time. And so I told her, and she had just gone to get her eyes checked too. I was like, oh my gosh, my friend, they just opened a place. And she was like, oh, thanks for telling me now. So hopefully she'll be coming in to see you too, but you can definitely go visit her.
Absolutely. Well, that's great. That's really nice to know. Next time we're there,
Yes,
absolutely are. We're saying hello.
that's awesome.
That's awesome. Yeah, I
Um,
had no idea.
and that's such a great area. Like I love that. The town, like you said, there's so many suburbs kind of surrounding. So it's a great community and there's a lot of people that kind of feed in. So that's a great spot for you, which is fantastic.
Absolutely. Absolutely is.
Awesome. So let's talk about, so how long have you been an optometrist?
So I've been practicing for over 10 years.
Okay.
I worked in a corporate setting when I was straight out of school for a few years. And then I joined a private practice where I was for over 6 years. And I've had a very great patient following there. People have been seeing me for years. They're now kind of trying to find me and see where I went because I didn't want to let anybody know at the time, but now they're starting to realize I'm not there anymore. So they're slowly starting to creep in a little bit
Sure.
here and there. So that's been wonderful. But yeah, I was at that practice for over 6 years. And now I'm officially here in my own.
I love it. I love it. And I love that I love that you have family eye care in the name. I think that just makes it so much more welcoming. And I love, on your Instagram, you guys have a great social media, but that you have kids coming in, adults. So you have something for everybody. But that leads me to kind of, I want you to talk about and introduce the things that you really specialize in and the services that you guys offer.
Absolutely. So as I said, I will see anyone starting from about 6 months old and up. And what I think is so important is it is recommended that their first eye exam for babies is at 6 months of age. And at that point, it's very quick and it's very easy. And parents are always so stressed about it. But all we do is we shine a couple of lights in their eyes. We see how the light reflects off of the eye, off of the retina. We check the health of the eyes. It's a very gross kind of exam. Make sure they can follow the light. We can make sure when we compare one eye to the other, they're following it equally. It's a very simple exam. We often do drops to check the health of the inside of the eye. But babies, when they're that little, they honestly don't even care. It's perfectly fine. Half the time they just sleep right through it and it's not a big deal at all. Then if everything's fine, what is recommended is that their next eye exam is at 3 years of age. At this point, they're more engaging and they can answer some questions and they can do more things. And we check their eyes again, just to make sure that everything is developing properly, that everything is developing in a healthy way. And then at that point, the next exam is recommended right before they start kindergarten. So when they're 5 years old. And from then on, it's yearly exams until we're in the nursing home, until we're older. So really, yeah, so that's what the American Academy of Optometry recommends. So that's what we go by. And patients love coming here. Little kids love coming to see me. They always have fun here. We have lots of equipment for them. We have cartoons that we show them to kind of distract them. We'll do anything to make our little patients happy. Absolutely. And then as they get older, for kids who end up needing glasses, if they're nearsighted, we have a whole program for nearsighted kids. Nearsightedness is myopia. That's the medical term for it. So we have a program called Myopia Management Program here. And there are now ways for kids who are nearsighted to slow down the progression of nearsightedness, because as we grow, our eye grows with us. And as the eyeball itself gets longer, we become more and more nearsighted. And the reason I'm so passionate about it is because I'm very nearsighted. I have a very strong prescription. I'm always my contacts or my glasses. I really can't see much without them. And when I was little, this wasn't available. So I've got this very thick pair of glasses or these really strong contacts, which help me see very well and everything's great. But as nearsightedness gets worse, the chances of diseases developing really increases. We have more chances of glaucoma, retinal detachments, of complications with the eye. So the lower we keep the nearsightedness, the better it is. And there's been a huge kind of epidemic of nearsightedness lately, just because of the increased screen time, the increased up close time. Everything is on our computers and iPads, even at school. So
I didn't even think about that.
Yes. So it's been wonderful. It's a great program. I've seen amazing results. It really helps to slow down the progression of nearsightedness. We can do it with prescription eye drops. There are specialty contact lenses that this can be done with. But the point is, there is now a solution to it, which is amazing. And I've seen so many kids benefit from that. It's just wonderful.
Oh, that's
Absolutely.
awesome. That's awesome that
Absolutely.
that's something you kind of struggled with. And I mean, that always makes us a little bit more passionate about it, right? Wanting to help other people.
Absolutely.
And
Yes.
yeah, so they don't have to go through the same thing. So that's incredible. I didn't even think, and that's a great thing of, but I'm sure people are struggling so much more with their vision with the screen time.
Yes, absolutely. So there is a whole subset of diseases called computer vision syndrome, where our eyes just get so much more tired from the use of screens, for the increased use of screens. It's really everyone nowadays. You don't have to be a computer programmer or be in IT to be using the computer a lot. I, as a
Sure.
doctor, find myself staring at the computer screen half of my day. So it's been a lot. And it gives you headaches. It can make your eyes tired. It can give you pain in the back of your neck. Your head can hurt. There's so many things that come together with it. And it's so important to make sure your eyes are in optimal health and your vision is in optimal health so that you don't struggle with it.
So I want to kind of, before we talk, because I know you do also specialize in, in health with older clients also.
Absolutely.
But what can people do? Because especially like with the screens, I know even as a personal trainer and corrective exercise specialist, there's a thing now in textbooks that's called text neck, because we are, looking down constantly. And I'm sure, and the eye health is obviously affected as well with the screen time. But what kind of things can we do, like as a preventative, um, to help our eye health? Like even if it's supplements or limiting screen time, or do those blue light glasses work? Are there things that we can do, besides coming in, for an eye exam to check out our eye health, that we can do to be proactive?
Absolutely. So the number one thing is called the 20-20-20 rule. So the 20-20-20 rule is that for every 20 minutes of up close work, that could be reading a book, that could be being on your phone or a tablet, that could be using a computer screen. For every 20 minutes of up close work, you take a break for 20 seconds and you look at something that's 20 feet away. So you can't take a break from your computer to your cell phone. That's not a break from your eyes. You need to look at something far, something at distance. So if you have a window, you look out the window. If you're sitting somewhere where there's a long hallway, you look down the hall. So every 20 minutes, a break for 20 seconds and look at something 20 feet away. So I usually say every 20-30 minutes, just take a short break. Go for a walk, just look out the window, do something, and then go back to working. That really helps to relax your focusing system so your eyes are not getting as tired. Absolutely.
I love that.
It's simple and it works. Supplement wise, a lot of the times what happens when we use screens or even a book, again, anything up close will cause the same issue. It doesn't necessarily have to be a screen. A lot of the times what that will contribute to is dryness. And there's a lot that has to do with dryness. Your eyes get very dry because no matter what we're doing, if we're looking at something up close, we blink less. Less blinking means that there's less tears on the surface of the eyes. And so we struggle with dryness more. So simple things other than taking breaks are literally blink exercises. And it sounds like it's silly, but literally squeeze your eyelids shut a couple times.
Okay.
Do that
because I suffer from that.
Definitely do some squeezing, literally like hard blinks every 20-30 minutes, just a little bit. It helps to secrete the oils out of the glands that are in our eyelids and make our tears more healthy on the surface of the eye. That helps with dryness as well. So artificial tears, supplementary artificial tears will help to lubricate the eyes as well. Supplement wise, fish oil. Good quality fish oil is amazing for what it does to your joints, to your overall health, but also to your eyes, to the health of the eyes, to the dryness issues. It is very, very, very beneficial. So for that kind of situation, definitely fish oil. I highly recommend it.
That's fantastic. Good to know. I take that too. For many,
good.
The joints thing is a big thing, and some brain health. But for eye health, that's awesome. I'm happy to hear that. And I suffer, and I can't even tell you what this is. Years ago, I'd gone to an eye specialist because I was getting like tears in my cornea where like it would just split. So at one point, I've been a makeup artist also for like 20 years, semi-retired. But at one point, I literally did kind of, you know, stab my eye with a mascara wand
Yeah,
accidentally.
definitely happens.
So that kind of did it. But then and that was the worst pain ever that I had gone through. But then it had happened just on its own on my other eye. And it was when I like woke up. And then I had it happen like a third time. And so I went to the specialist and he's like, you have to lubricate your eyes. And he said I had some long name, I don't even remember it, that was basically where my eyes would get really dry. And when I kind of opened up, it could
Absolutely.
tear.
Yep.
And I was like, I never want this pain again. I feel like there's a needle in my eye and it's excruciating. So always now, not as much before bed, but like in the morning, like the first thing in the morning when I wake up, I use Systane. Hopefully that's okay. I use Systane
Sustain is
eye
okay.
drop
Yes, absolutely.
in the morning. Like before I have to like slowly open my eyes up and I use my Systane and then I'm good to go.
So you should do it before bed, and it's even better that you do a gel-based tear. Even Sustain has a gel-based tear, because the
Okay.
reason it happens in the mornings is as we're sleeping, we're not blinking, so there are no really tears covering the surface of the eye as much, and so
Yeah,
the eyelid
makes
kind of
sense.
gets stuck onto the cornea at night, and then when you open it up in the morning, it creates like a rip in your cornea. So do the drop before bed, and you will prevent it even more. It's definitely
Got
a
it.
better choice. In the morning is perfectly fine too, but the one before bed is more important.
More important. Thank you, Dr.
Absolutely.
Veronica. I love
Oh,
that.
you're
That's
welcome.
so important. But it is, I was like, this is the worst pain. Like, what's happening? Like, I didn't put anything in my eye. What's going on? And sometimes I get a little nervous with jujitsu too. If like my eye gets kind of hit or rubbed, like, or something kind of gets in there. And I do have one of my friends, Dr. Joe. People will know him in the jujitsu community, but he had prescribed me an eye drop, like a medicated eye drop, that if something did happen like that I could use it. So I have it just in case.
Good,
But
good.
with emergency, because I'm like, I don't want to feel that. So
You're
thank
prepared.
you. I will get the gel
The gel one,
Systane
yes,
for
try the
sure.
gel one, absolutely. Absolutely.
Definitely. So with what are some of the things that you find kind of as we get older and with your older clients and things that we can kind of look out for as we age?
So obviously, any kind of diseases that can affect the eye, I can definitely treat here at Expert Family Eye Care. Anything from cataracts to glaucoma to retinal problems, diabetes related changes to the eye, we can monitor everything here, take care of everything here. One of the other specialties that I'm really passionate about is dry eyes, which seems like it's not that big of a deal, but for people who truly suffer from it, it can be devastating how dry they are. There are people who will have to use their eye drops more than 4 times a day, more than 10 times a day, and they're just not finding a
Oh
good
my
relief
God.
for it. Yeah, so for you, you just do a
Wow.
drop in both eyes and you feel good for the rest of the day. But imagine that
Totally.
feeling, it just never ends throughout the day. It's just very difficult, it's very bothersome. So we definitely have a whole array of things that we can offer that help with more chronic dryness. There has also been a lot of it lately, again, because of the increased computer use. We are seeing so much of it more in adults and even in kids. You'll see these first graders, second graders, third graders, where there's so much dryness that wasn't there 10, 15 years ago. It's
Right.
really the less blinking is contributing to it. For the older population, when we get older, dryness has to do with hormonal changes, with our body changes. There are glands in our eyelids that go vertical like this in the upper and lower eyelid. They're called meibomian glands. And they tend to function less and less as we get older. They can even start dying off as they get older. And as you develop this meibomian gland disease, dryness really becomes very bothersome. And so some of the things that help with it is taking very good quality fish oil supplements. Some artificial tears can help with that. But when we get to a point where that's just not enough, there are prescription eye drops that are out there. There are procedures. One of the procedures that I do here is called the iLux procedure. And what that does is it's a special device that warms up the glands in the eyelids, We apply it to
Okay.
the eyelid, we warm them up, and then it expresses the glands and it makes all the oils come out of the glands so they can start functioning a little bit better. They can start rejuvenating. And it's been really life-changing for many of my patients. They find it very, very beneficial. So,
Oh,
so many
wow.
things that have to do with our eyes as we get older. And I just can't stress this enough that people really feel like my eyes are not bothering me and I'm seeing well and I don't need to be seen. But the scariest thing about the eyes is the majority of diseases that affect the eyes are slow and they're progressive and they're completely painless. So unless you actually have your annual eye exam, unless you actually are seen by your doctor regularly, half the time we catch things too late
You
when
wouldn't know.
it's too late to bring the vision back. It's so just here's my public service announcement, yearly exams for everyone, please. If you're fine, that's great. You don't, just go on with your way, but we just want to check once a year.
Right. Because
Absolutely.
I'm sure a lot of these things can also be treated. If caught
Yes,
early, it,
absolutely. And the earlier you catch it, the better.
yeah.
That's the kick here. Yes, absolutely.
Well, that was good. I'm glad you said that PSA because I was going to ask. I'm like, so how important is it really to come in and can that much, we go to our yearly physicals, you're going to the dentist every 6 months, like getting your eye exam, is that important? I mean, a year may not seem like a long time, but it is a long time. A
But it is a
lot
long time.
can change.
Absolutely. Absolutely. Yearly. Once a year, if you're healthy and nothing is wrong and you have no complaints and you come in and your doctor says your eyes are perfect, that's wonderful. Just come back in a year and hear that message again. You want to hear again, your eyes are still perfect. We'll see you back in a year. That's what you want to hear.
Fantastic. And from now on, I'm going to be coming to visit you because I
Please do.
still have, even though we moved to Maryland, I have my primary care physician, my gynecologist. I have everybody still in Illinois, all my
Just don't come
doctors.
to us here for that.
So I'm going to come to you
Thank you.
for my eye health. Why not? It's great.
I
I
love
have my crew, my team of people. So it's awesome. But, you know, I want to also, now that we've kind of gone over a little bit more of the clinical stuff, I feel like frames and eyewear have become, and maybe they always have been, but like super trendy and just a great accessory. And I have so many different glasses and I don't need to wear contacts. I can see without my glasses. I have a little bit more of like astigmatism, but when I can tell I'm just more focused, especially when I'm reading or on the computer, but I can still see without
Right.
my glasses. So fortunately, because the thought of putting contacts in my eyes just freaks me out. Uh, so my parents, though, they both have to wear glasses all the time. My sister will wear contacts. So I think I probably have like the healthiest eyes out of everybody. But I love my frame and I'm obsessed. So have you seen that that's just become like more of a trend of more people wanting to wear frames versus contacts?
Absolutely, both adults and children are just so into glasses nowadays. They're so trendy. There are different styles, and some people want to go for something more modern, but we're kind of going back to the retro look as well. We want the thicker frames, the thicker
Yeah.
glasses. The aviators are back, the double bridge aviators are back. So everything is kind of coming back, and people are really into their glasses, their prescription sunglasses. There's definitely been a trend of that. Absolutely.
And that's a great transition, as you say, prescription sunglasses. But how important is it to wear sunglasses? Like as we're outside, just for vision and eye health, is that something I'm horrible with wearing my sunglasses, but is that something that is
Yes.
a thing we should practice?
Sunglasses with UV protection, very important.
Okay.
Many diseases that happen to the eyes are the result of UV exposure. And it doesn't have to be going and tanning in a sunbed 10 years ago. It
Sure.
just us being outside, if it's not nighttime, it doesn't have to be sunny, but UV rays are out there. And so they are very, very damaging to the lens inside the eye. That is how we develop cataracts. So, for
Okay.
example, people who work outside, your landscapers, the people who work on roofs, construction workers who are outside, you will notice that a lot more of them develop cataracts much earlier in life because if they're working outside without sunglasses with UV protection, lots and lots
Mhm.
of damage to the lens inside the eye, and so they end up with cataracts. Inflammation
Oh,
on the surface of the eye from UV light causes redness, causes growths on the surface of the eye because of UV exposure. And more importantly, the health of the retina, the inside of the eye, is very much impacted by it too. So sunglasses should be your best friend. UV protection on them, and wear them when you're outside. Please, they're good for you. They're amazing.
Okay. I will. I'm like, I will.
And
I
they can
will.
look really cute too.
For sure. Totally. Totally. I have a
Yes.
really cute pair. I'm just so bad at like, I just don't
And
always put
switching.
them on. Yeah,
Then you do
exactly.
transitions. You know how they get darker when you go outside? Do that next
Yes.
time. They protect your eyes from UV light as well. Transitions are wonderful.
I have to do that. I know there's so many fun things like now with lenses. I feel like, you know, people too who are worried or like would have to get like bifocals or really can't see, like you can make that kind of like seamless now, right? Like
Yes.
in the lens. Yeah, it's just all like you can't
The
even tell.
options are endless. Like they're literally endless. Whatever you want in there is doable. You can make your lenses pink and have them be bifocals and still get darker outside. Anything you can imagine can be done. Absolutely.
So I have a question. I wonder if Dr. Veronica knows this one. So, as I do my podcasts or videos or photos, lighting is a huge part of it, right? Good
Yes.
lighting. And I utilize a ring light a lot. And I have my ring light on right now, but it's very, very low, like hardly on, because I always see the ring in my glasses. And I feel like I can't, when I do a lot of stuff, I'll have to do it without my glasses. But I love my glasses, so I
Yeah.
like to wear them. But I can never find an easy, I'm like, how do I get this great light? Do I have to just get a different style or figure it out? Because it's always in my lens and the reflection. And I
Yes.
wonder if there's a type of lens that you can get that would not reflect, or if that's just something that's an unfortunate thing with the ring light.
It's hard to tell from you looking at your glasses, but the anti-reflective coating or the anti-glare coating really helps with those extra reflections. It's not going to eliminate them completely, but it will definitely make it a whole lot less visible. And you might already have it on there. It's hard for me to tell because you're saying you dimmed down the light as well. So I can't quite tell if it's just dim
So
or
if we can do this because we're on our video, wrong way. But if here you can kind of see, I don't know if you can see
color
that.
is totally different. Yes.
Woo, that's real bright. But it gets, you can see that nice rim of the ring light that
Yeah,
kind
I
of
can see that on
reflects
the top of your
through.
glasses. Absolutely.
Yeah.
So make
it's
sure
just
yours have the
so
anti-reflective coating. That
distracting.
should help with that. Absolutely.
Okay.
Yes.
Well, I'm gonna talk to you about my next set of glasses because, like I said, and I don't know if anybody else watched The Watcher. I don't even know what it was on now. There's so many platforms, but Naomi Watts was in it, and she had this like iconic classic pair of like thick black frames, and I don't know if they were like Gucci or Prada or something. But I want a pair so bad. I'm like, not that I need another pair of lenses, but my prescription didn't change too much. We can pretend it did. I definitely want to, come in. Maybe we are coming home next week. So I'm like, maybe I can stop in. But I want to check them out. I'm like, I just love the style, and I just love a nice thick lens and frame, or frame,
Absolutely.
not lens, I should say.
Absolutely. And I'm going to make sure to look up that movie and look up Naomi Watts in that movie and figure out what glasses she's in. By the time
I'll send you a pic. It's on my
Please
phone
do.
right now, which we are using our Zoom through, but I will send you a picture. I took a screenshot like a couple days ago because I'm like, I have to show Veronica this and see if I can get a pair. Now, I don't know if they'll look good on me, but hopefully we'll find something that can work.
We'll find something that works for you. Absolutely.
I love it. So tell me, I feel like we've kind of gone over all this stuff. Any other like fun tips or facts that you want to share with us?
You know what, I realized you asked me a question about blue light protection in your glasses and I never answered it.
Yeah.
So
Great
there's
memory.
a lot of research on it, a lot of research. And so there's a lot of kind of misconceptions about it as well. So the one thing I want people to understand is that it does not prevent your vision from getting worse. So just because you work in front of the computer and you put on blue light glasses, I don't want patients to think that this is it. I'm using blue light protection glasses, so my vision is not going to get worse on the computer screen. So that's not true. What it does help with is it helps to relieve some of the eye strain that we get from the bright computer screens, because it does block blue light, and blue light is harmful to us. It is harmful to the lens in the eye. It can cause some cataracts as well. It is harmful to
Okay.
the inside of the eye, to the retina as well. So it is good to wear them, and they can prevent worsening of some eye diseases, but not so much of progression of your prescription changes.
Got it.
And another thing it helps with is it helps with our sleep cycles, because there's a lot of research on blue light and the fact that if we're on our devices, staring at our phones before we go to sleep, we tend
Mhm.
to mess up our sleep cycle, and then it's harder to fall asleep and it's harder to stay asleep longer. So if we,
Interesting. Yeah.
yes, so they recommend that about 30 minutes to an hour before bed, we stop using devices and watching TV. I don't know how realistic that is. I myself can't make that happen, but because I
Yeah.
fall asleep with the phone in my hands, but that really would make a big difference with sleep. And so blue light glasses also help with that. So again, I'm not saying be on your phone until you fall asleep like I do, but
Totally.
blue light protection helps with that a bit. It doesn't prevent your vision from getting worse, but it definitely helps to relieve strain, and it helps with the sleep cycle. That is true.
That's interesting because I know, and I've told people this too, just with some of my coaching and consulting. Um, it's you do obviously want to kind of shut down devices and stuff, just before you're going to bed a little bit more, have that bedtime routine, if you
Yes.
will, and that's going to keep us up. If you wake up in the middle of the night, maybe read a book instead of going on your screen. But the fact that the blue light can actually help with that, that's
Mhm.
a great recommendation. And can you get your lenses that have that? Like, can your glasses have like a blue light blocker?
Absolutely. You can have your prescription
Okay.
in there with the blue light protection. And that also gets rid of glare off of screens, like what you and I talked about for your
Yeah.
glasses. So you can
Okay.
have that anti-reflective coating, that anti-glare coating with the blue light protection built into it. So you're protecting your eyes from the blue light, you're getting rid of glare, but you're also seeing well because they're in your prescription. Absolutely.
Awesome. Okay, this is great to know. That's an awesome tidbit. And if people want, because obviously not everybody lives, near Lincolnshire, Illinois, but are you able to send kind of glasses anywhere out of state? Can you work with patients
So
kind of
theoretically, it's
anywhere?
possible, but I don't recommend it because glasses are still medical devices. We don't think of them that way, but they are. And everything needs to be measured properly with your glasses, not only your prescription itself, because you could send me your prescription from Maryland, but the way that each frame sits on each individual patient is different. So your beautiful
Mhm.
frame sits on your face a certain way. I might put it on and maybe have a bigger nose, so they'll sit a little bit higher. And when they
Right.
do that, the optical center, the very middle of where your pupil is looking through in this particular frame might be different to where it is in mine. In mine when I put them
Okay.
on. So they really should be measured properly by an optician who is trained to do this. You'll get much better clarity of your vision. You'll be a whole lot more comfortable with them, and you'll get much, much better results.
Awesome. So that just means I do have to come in and
You do
visit
have
you.
to come in, but
I
you'll be here
have
next week, so it's easy.
Yes, yes. I'm like, I do have that like Italian schnoz and it's a little big. So sometimes glasses don't always
We will
fit
find you the
right.
perfect pair.
We'll just say that. This has been amazing. I'm so glad that you've been able to take the time to just fill us in on everything in the eye health realm. And congrats again on opening up your own location. I think that's fantastic. And I'm so excited to come in just from seeing on social media all the pictures. But where can people follow you? We need everybody to know where to go.
So we're on Instagram. So just look up Expert Family Eye Care in Lincolnshire, Illinois. We're also on Facebook. We're trying very actively to be there as well. We have a very active Facebook page that actually Sergey takes care of all the social media. That's all him. My job is just to take
Awesome. Good
pictures
job,
with
Sergey.
patients. Yes.
Yeah.
So
You have a
follow us
very
on
important
Facebook.
job.
Thank you. Thank you. I try my best.
That's
So
awesome.
Facebook and Instagram. Yes.
Okay. And then your website is expertfamilyeyecare.com.
Yes, it's expertfamilyeyecare.com, and it has a lot of information about the services that I offer here, what we do here, and it's very easy to schedule your appointment online. Right there, there's a link that says schedule my appointment, and it will show you all the available appointment slots that we have, and you just click it and you're scheduled. It's very simple.
Awesome. But I love it too for those people that are, that don't live in Illinois. I feel like on your social media also, you guys give great information and insight for anybody to be able to kind of take away and use and go ahead and see their healthcare provider with. So I think
Absolutely.
that's awesome that you do that and you give out that information because that's really what's super important at the end of the day. And that's what people are looking for. So thank you for doing that. That's fantastic.
Course. Thank you. That was important to us as well, that we could spread the word about the health of the eyes, everyone, not just to our patients, but to everyone around. Absolutely.
That's awesome. Thank you so much, Veronica, for taking the time. I can't wait to meet you in person. I'm
Hey,
like so
thank you.
excited. Yay. And to all the listeners out there, any guests that you'd like me to have on, I love referrals. Send me a message on my Instagram at all things Gen Z. And stay tuned because there's going to be some changes in the Gen Z world. I'm going to be offering some more options, subscription content plans, really exciting stuff. So that'll all be launching soon. I'll probably come on and do a podcast about it. So stay tuned. Dr. Veronica, thank you again. Everybody have a fantastic day and we'll see you soon. Bye.
Bye. Thank you so much. Thank you.